I knew that I wanted to be a nurse ever since I was little. My older sister actually got bacterial meningitis when she was about 10 years old, and I was 8 at the time. And so she was in the hospital for over 10 days. And so being alongside her in the hospital setting and seeing how the nurses cared for her, and not only for her, but for our whole family, was really impactful even as a little girl, and just made me really want to do that for others. So from that experience, I knew at that time, even as a young girl, that I that's what I wanted to go into, and I wanted to, yeah, be a nurse and be able to provide that care for other people. Moving forward, I went to for nursing school and really loved my nursing school experience, but unfortunately, it was a little bit different than your typical nursing school experience because all of it but the first semester was heavily impacted by COVID. And so unfortunately, after that first semester, the school had to cut down on clinicals, and some moved online, and some were just taken away completely due to safety concerns. And so the clinicals that I did have, I really loved, but unfortunately just didn't get a ton of that experience. And so then I graduated in 2021. And after graduating, I just didn't feel super confident. I didn't know if I was ready to go into a hospital type situation just because of the nature of clinicals. So I ended up working at a high school, and I really enjoyed working with that population and working with the kids. So had a really good experience with that. And then moving into the summer, I was a nursing supervisor at a summer camp in Yosemite. So again, got to work with the pediatric population, which I really enjoyed. Then after the summer camp, another thing that I have always been passionate about is gymnastics. Grew up doing gymnastics, and so I had the opportunity to coach two different gymnastics teams. So I did that, and then just kind of all of my experiences combined and reflecting on my time since graduating, I just realized that I really do want to transition into like a more acute care hospital setting. And so, but with that kind of lack of confidence, I decided to enroll in a RN refresher course because I just really wanted to go into any role that I got in the hospital confident in my skills and in my knowledge. And so I have been taking that course, and
What are you excited for? What are you looking for?
yes, and I'm really excited coming like now on the backside of that, coming out of that. I feel like I have gained a lot of skills and confidence in that. So I feel really good moving into a hospital type position. And I have always, really enjoyed working with pediatric populations. And one of the clinical rotations that I did get the opportunity to have during nursing school was the OB rotation. And I really loved that. I think that labor and delivery, I think it's a really unique specialty. I really like the dynamic and fast-paced nature of it. And I also think it's cool because it's, one of the biggest moments in someone's life and a big start of a new chapter for families. So I think that part of it is really cool.
Yeah, no, I think that's good.
So
A
that's
lot of
another
people are in this boat, if that makes you feel better. Like
that
everyone
does.
thinks it's just them, but this is like your nursing generation. Clinical is just casually canceled. Just
Yeah.
what?
Yeah.
Yeah, so tell us for sure.
That's good. That's good.
And then yeah, just say something that you like about the hospital. And then you could, I don't know if you can say it in a way that sounds humble, but you could talk about how you really liked the sort of educator role that you were able to do as the school nurse working with parents, and same thing at the camp as the supervisor, you were able to, I don't know, something about, because it makes you sound boss. That's why I want you to say it. Makes you sound like a grown-up. I don't know if you can like casually slip in there like how much you liked kind of like the education of like patients and their families, like as like the opportunity for that the school nurse role gave
Could
you.
I tie that in and be like, I really liked that part of working as a school nurse, and I know that working in labor and delivery, they're like new parents, and so education is a big thing
Yeah.
type of thing, or no?
Yeah. And you can tie, yeah, you can use the thing with your sister to tie back how you really enjoyed this, but it wasn't quite what you went into nursing for. You're really being called to the bedside, so you did the RN refresher course to really make that happen for yourself. And then now you feel like it's time, you feel like you're ready, you feel like, you know, you want to get your hands in on the front lines and really do what you've always wanted to do. And I think something that goes over really well for this type of interview is if you can talk about a time where you maybe had a parent that, or like a dad that was like really hesitant, and you were able to like teach him how to give the first bath, and he was like really proud of himself, or like he was like, I've never changed a diaper before, I don't know how to do this, and you like taught him and he started doing it and was like, oh my God, I can do this. Like I think
Mm-hmm.
that kind of stuff goes over really well for perinatal type of units if you have something like that.
Yes.
About that. No. What about sweet moment where people were separated because of COVID and you helped them find a way where they could communicate and it meant a lot to them or something?
Hmm.
What about, did you ever set up a Zoom call? No.
Yeah, I feel like when I worked as a med tech over the summer, they couldn't have visitors, but they could have phone calls. So I helped patients set up phone calls because they were old and like didn't know how to.
Okay, so when they ask you that, you can say what comes to mind from, and you don't even have to say where it was, like that it was when you're a med tech. You can say what comes to mind when I think about going above and beyond for family-centered care. I realized when I was in nursing
Mhm.
school that a lot of the older generation was kind of left out of communicating with family the way that the younger generation could, because they didn't understand things like Skype and Zoom and FaceTime. That they had phones that were capable of doing it, they just didn't know how to use them. So
Mhm.
that was just a little thing that I could do for them to make sure that they, or like I would coordinate with the family and set up a time and go in and just quickly, you know, do the call setup for them so that they could still see their family. And it was just something that I could do for them that was a little thing, but it made a big difference in terms of keeping them connected with their family when the visitor restrictions were pretty limited. And there were a lot of small but impactful moments of seeing them be able to see their family members for the first time in weeks, or realizing that they were able to and they weren't alone, and just maybe just talk about what you found or what you've learned in terms of family-centered care is just finding little ways to make the care tailored to not just the patient in a vacuum, but the patient like as part of a family unit.
Mhm.
Or, I mean, you could even talk about like as a school nurse or like a camp nursing supervisor. There are often a lot of opportunities for education of families that helps the child's care be more understood and the flow of everything be easier.
Mhm.
If you wanted to be like add that in as like another vague thing.
Okay.
Yeah. Just
Okay.
you know, like you know how to be nice to a family member, you know.
Yeah.
Yeah.
Okay, yeah. That's helpful. Thank you.
Yeah. If you want to download my list of 72 new grad nursing interview questions, that PDF is linked in the description. Don't pay full price for it as a supporter of the channel. If you use the discount code YouTube, it's only $3. I made it all cute and aesthetic for you guys. It's 22 pages. The idea is hopefully interview day won't be the first day that you encounter whatever question they ask you. I've included every interview question I've ever heard of that any new grad has ever been asked. Don't pay full price for it. As someone who supports the channel, you get it for only $3. Just use the discount code YouTube.
The story that comes to mind for that, I don't think is great because it was a critical situation, but it was at the camp, and so it wasn't like it was it was basically like
have your resources, huh?
one of the staff members like went into anaphylaxis, but he didn't know he was allergic to bees, and that's what he went into anaphylaxis from, but he had an EpiPen because he was allergic to peanuts. But like I don't really think it works for this.
I mean, it kind of does unless you have something that's going to be kind of more your normal workflow.
Right.
Just say you've had emergency situations as a school nurse and in Yosemite as a supervising nurse, and it can be hard when you don't have a lot of resources or support staff that is, like a rapid response nurse or something like that, that you kind of just have to take charge and stay calm and do what you can to coordinate with everyone what you need them to do and like direct them and have everything run smoothly. That you had a patient who didn't know that he was allergic to bees until he came into your office anaphylactic, didn't understand necessarily what was going on, and you knew that you recognized it as anaphylaxis. You knew from his history that he had an EpiPen because he was allergic to peanuts, and you had someone locate that, bring it, and were able to administer that, and you did whatever supportive things in the meantime, either it was like oxygen or I don't know, coffee or whatever, like similar thing in the meantime. I'm so used to the normal workflow. I don't know if you called an ambulance or
Yeah, we call it ambulance. But I'm like, I don't know if that's like good to say because it's like obviously if you're at the hospital, you're not calling an ambulance.
Yeah. What else did you do in the meantime? Or like what did they do? Like obviously you took vital signs, and you like, what did you notice, right? Did you hear stridor? Was his O2 sat down? Like was his blood pressure tanking? Like what did you see that you were like, this is anaphylaxis?
Well, he was like bright red and like quickly developed like hives all over his body, and then his throat was like closing up, and he was like starting to like not like he could still breathe, but he could like actively feel his throat starting to close up.
Yeah. I think
I also have another one that maybe would be better. It's still not clinical, but at the school we had a student who had a seizure in the middle of the hallway, and so she had told her teacher she wasn't really feeling good, but she come to find out she had had a seizure since she was little, so it wasn't like she wasn't on any meds for it, and it wasn't even in her care plan or anything like that. So basically she just like told her teacher she wasn't feeling very good. She like went out into the hallway, and then she fell and started seizing. And so then our whole team of the administration came because it was passing period. And so security kept the kids away from her. And then like I directed someone to call 911 and then turned her to her side and all that.
And you noted like what time it started and what time it ended, like, and gave report when the ambulance showed up.
Yeah.
Yeah, I think either of those would work.
Okay.
Then you can talk about how, while it's been great to have the experience of being the one everyone turns to for answers in a medical emergency, and like getting experience with calmly directing people and assigning roles and that kind of thing, giving report to the paramedics, you're looking forward to having staff around you and like equipment around you to help and learn more about the inpatient emergency care, like rapid response nurses, and have meds available that you can give, have a PRN IV Ativan that you can give, and that kind of thing, and be able to work with EEG and I don't know, be able to start them on Kepra or whatever. You can kind of say that while it's been a great experience, kind of being the Lone Ranger, you're very much excited to have teamwork in that
Mhm.
kind of situation.
Yeah.
Yeah, but I know, I mean, it is a really special skill to be the one medical person, have everyone turn to you and be like, what do we do? And you have to stay calm and assign each person a role that makes sense for them. You know what I mean?
Yeah. Yeah.
Yeah. Another thing that they often ask in these perinatal type of interviews is if it's L&D, they'll say something like, oftentimes people come in with a certain birth plan and
Mhm.
then things happen and they have to have a change in the plan of care. How would you help a mother through that? Another common one for like this genre or this like unit type is they'll say something like, a lot of times there'll be disagreements between doulas and the medical team.
Mm.
How would you handle that type of situation? It's also kind of a tough one if you haven't had that exact situation, but I don't know, maybe you've worked with two providers or two, I don't know, entities that had differing opinions and you had to kind of help mediate that in the interest.
Yeah. Yeah.
The last L&D type question or like mother baby NICU type question that they can ask that's common is they'll say something like, often what mom wants for baby is different from what the healthcare team feels is safest or the best for the baby. How would you navigate that situation? And sometimes people talk about like
Mm.
sticky code statuses that they had to help get changed, you know?
Yeah, I know. That is what I struggle with because I don't really remember that much. But
A lot of people, when they
yeah,
watch the
I
videos,
will.
they're like, oh, I do have a story. Something similar happened to me. And they don't remember it until they hear someone else tell their story. And they're like, oh, yeah, I guess I do have something, you know?
Yeah.
Yeah.
Yeah, no, those videos are really helpful. Yeah,
I'm
for
just
sure.
really glad people are willing to like share their, because like I hate being on camera and I'm like the one,
Yeah,
like,
I know. Same. I thought about that exact thing. I'm like, wow, those people are so brave for letting
right?
their videos be just out here.
Yeah. Yeah. And they do it just because they're like, this is so stressful for me. Like, if I could make this less stressful for someone else, like, sure, that's fine.
Yeah,
I'm like,
yeah.
you're really cool. Like,
Right? I
yeah.
know.
Yeah. I'm really
Super
glad no one's
helpful.
like torn them up in the comments. Everyone's just like, wow, cool. Thank you. This helped. If someone came at them,
Yeah,
oh,
that's
I would go so mama bear. Like, for
good.
free? You didn't get paid for this? You're welcome. Anyways. What about the one of, because they'll ask like a time you made a mistake, and it's not just that you listed a mistake. It's like you have to talk about how the mistake happened or like almost happened or whatever, and then like how much you were like alarmed by it because if this same mistake had been applied to a higher stake situation, like it could have been so bad, and that because you never want something like that to happen, what you decided to do differently and how it's really helped to keep your patients safe.
hmm Yeah, okay. So for that, I feel like I have my like go-to one that I always think of is when I was in the NICU, I was doing my round of cares or whatever. And so I did all the cares on the baby, including, changing her diaper and all that kind of stuff. And then after the fact, my preceptor was like, oh, you weren't supposed to do that because you were supposed to wait until the family was there because they really wanted to be a part of it. And that was in the notes or whatever. And so to be sure to look in the chart. I don't know.
Yeah. Or you could kind of give the back history first, whoever had decided that and what had been decided, and that you hadn't spent enough time. Like you were so excited to just do the cares and like be really hands on that you hadn't done your due diligence of really going through the nitty gritty of the note, which is
Mm-hmm.
really embarrassing that you didn't know that, and that you had done the cares without including the family. And it taught you very early on that you like to get there early and go through the note. That way, before you even touch the patient, you know exactly what what the plan is and all the considerations and how to balance all the patient's needs. And
Okay.
for example, let's say that the note had said that they were stopping a certain medication today, and care got delayed because you gave it without reading the note, that you just went based on the MAR. Like, you like to take at least 5-10 minutes per patient before you start to work with them to really understand just at least what's in the note, in your orders.
Mm-hmm.
Yeah, I think that's fine. And you can maybe
Okay.
talk about how upset the family was, or like
Okay.
or whoever was upset, and that you had to apologize, and you realized that this was, if you had read the note, this wouldn't have happened.
Mm-hmm.
And you can dramatize it, that that there was no excuse or whatever. I don't know.
Yeah.
Okay, cool.
So we had like 12 diabetic students in the school. I don't know if I need to say that part. It doesn't really matter. What one of the diabetic students that I had that wasn't completely self-care, which meant she came into the health room for lunch so I could verify her insulin and her carb count and things like that. She was Muslim, and so when it was Ramadan, she really wanted to participate in it, but she wasn't sure exactly how to navigate that since she was diabetic. And so I worked with her doctor to get orders that were specific to Ramadan, and it had like recommendations that she should at certain times, like when the sun was down, and then the insulin amounts that would go along with that, along with like doctor's notes that I gave then to the teachers to be extra careful in watching her in case her blood sugar dropped, and for like PE and stuff like that.
That's really cool. I love that. Yeah. Yeah. And you could just say maybe an extra piece of like, you love whenever there's an opportunity to bring part of someone's culture from home, like into their care, and tailor it.
Mm-hmm.
That makes more sense for their preferences. That it's always like a really great opportunity that you appreciate, or I don't know, something
Yeah,
to broaden it a little bit.
this was super helpful. So
Oh,
I'm
good.
really grateful for you for this.
What's your favorite part about working here? Or,
Oh
um,
yeah, I asked that in both of mine. Yeah.
yeah. What qualities have you noticed make new grads really successful on this unit?
Mm.
Might be a good one. Or like, what struggles have you seen new grads face on this unit, and what's been helpful for them?
Oh, that's a good one.
Yeah. All right. Well, this has actually been really fun. Thanks so much
Yeah, thank you.
for me. I'll
I like
send.
want to be your friend. That's a bummer.
Yeah,
You live
let's do
in San
that.
Francisco.
If I ever go to, they like, hey, where should I work? Where should I hike?
Yeah,
Teach me the
for
things.
sure.
Yeah.
Thank you so much.
Yeah. This is fun. Also, have fun too.
Thank
Like,
you.
smile, get comfortable enough that you can have fun in your interview. Because if they're like talking to people all day and you're like the one person that felt like a real human to talk to, it's gonna be like
Uh-huh.
game over for everyone else. So
Okay.
yeah,
Good advice. Good.
yeah. All
Sweet.
right.
Thank you
Have
so
fun. Let me know
much.
what you pick. If you have any questions, but like, feel free to email me. I totally don't mind. I want to know how you're doing, how this is going. I can help you with thank you
Okay.
notes too if you want to like draft something up and send it to me.
Okay.
What helps is
Cool.
when you ask them questions, just sponge up everything they say and then stick one thing into like each different paragraph of like, thanks so much for sharing about this thing, and talk about why you appreciate that or whatever. Yeah.
Okay. Got it.
Okay. All
Sweet.
right.
Thank you.
Yeah. Nice to meet you. Have a good night.
You too. You too. Bye.